So the revenue coming in is payments that are being received from the settlement. So it's included as revenue that we use.
Thank you for that.
So,
You got a quorum.
I know. We'll count you guys too. 5 o'clock, call a meeting to order of the Health and Human Services Board on July 16th in room 1400 of the Government Center. Roll call, please.
Sean Anderson is excused, correct?
Yep.
Mike Barkalow. Kathleen Findley.
Present.
Kathy Leaf.
Present.
Lisa Lind is excused. Deb Lindeman.
Present.
Dave Osnes is excused. Julie Smith.
Present.
Greg Telejohn.
Present. We do have a quorum, so we'll continue on with the meeting. Approval of the minutes of June 18th. They were in the packet. Is there any corrections, additions, or changes? Hearing none, they'll stand approved as presented. Any public comment? No, you're not going to speak? Oh. Okay. Nobody's here. Okay, business items. A financial report for June 2025.
Okay. Our financials are through June of 2025. Our on budget target is about 50% of what we had budgeted. Just a couple things to bring up. Let's see. So within our behavioral health department, last year at this time we had 900 or 270,000 in ARPA money. This year we're down to just the 90,000, and that's the peer support project that we carried over from the previous years. And then also what goes into this this line will be the Office for Violence Against Women. So that grant money also goes into this line. Our mental health revenues, I wanted to show it looks like we're way ahead of where we were at this time last year. That actually goes hand in hand with our Winnebago expenses down here under purchase services. Winnebago is about 214,000 over where it was at this time last year. But we are getting some money back, so we have 114,000 in revenue that shows up under this mental health revenue. So that's money we have recovered after we've paid Winnebago that expense. The other thing that's driving this purchase service line in behavioral health this year is placements at Trempealeau. So, and we do have a long-term placement there, so we'll see that continue throughout this year, and we'll see what happens next year with that. So CCS, our census has been lower this year, and they've been doing like more awareness of the services that we're contracting out for. So you do see that revenue down quite a bit from the last year. And then also the purchase services are about half of what they were last year at this time. That is creeping back up. I know our census, we just had a few admissions, so I think we're up 10 compared to what we were last month. Children's Services. Just wanted to bring up, so again, our purchase services, good news here, they're down quite a bit from where they were last year. So both Child Protection Services and Youth Justice are down. There has been a shift, so some of those child protection are going to subsidized guardianship, and the subsidized guardianship are fully funded by the state. So we do have some child support payments, but whatever we don't get from the parents, the state is making up that difference. So when we're able to move them to that type of a placement versus straight foster care, group home care, we're getting that funded from the state. And then birth to 3 is also embedded in here, so we do have contracted occupational therapy and physical therapy that we use for birth to 3. That's about 14,000 higher than it was last year at the same time, because our birth to 3 enrollment just keeps getting higher and higher. ADRC, again, our revenue is looking quite a bit higher than it was at this time last year. Quite a bit of that, we had the 2 new positions, so that's that match amount. So we're drawing in that federal match faster. Our GPR then is coming down a little bit faster. And then we had that marketing grant, so that fed into that amount. And then otherwise, we're down to the healthcare campus. Their census is steady for the skilled nursing facility and Orchard View. They do have an admission in Kitty Roads, and they have a couple of other ones pending. So we're hoping to see that stay off and be steady there as well. Overall, they are still showing, a positive balance. We do not have any depreciation expenses that have been booked yet, but overall we'll stay positive even when those are in place. Any questions for me?
Looks good.
Thank you.
Thank you. Next business item is analysis of the state and federal budget impact on health and human services.
Thank you, Chair Telejohn. Good evening. So we received some summaries just before the reconciliation bill passed, the federal bill, on July 4th. And we received summaries from our associations on the state budget and on the federal budget. Again, that was on the 3rd of July, so the night before the federal budget passed. That's the most recent summary information I had to share with you. The additional documents, I think you handed out, there's 2 additional documents related to the budget that Colleen handed out. Those came out in a memo from DHS yesterday, the Department of Health Services, so I didn't have time to get them in the board packet, but I thought you might like to see what the Department of Health Services had to say as of yesterday. In the meantime, what I thought I could do is just touch upon some of the elements of the federal budget and the state budget, understanding that a lot of things are in flux right now as they try and reconcile the 2 budgets, the state and federal budget, to see what the impact will actually be on counties in Wisconsin. So there's a lot of effort right now. I'm kind of waiting for the associations to weigh in on some of this. But when we get more current, more, I think, dependable kinds of information to share with you, then I'll go into that. I don't want to confuse you tonight by going through each of these things as though they're fact. Some of them are, but there are other things that could change going forward. So if you want to just walk through it with me here, let's start on page 36 of the packet, which is it's the Wisconsin County Human Service Association that provided this information related to the federal budget, again, from July 3rd of this year. And some of the things that I just wanted to touch on, I know that last month, Rhonda Brown, from our administrator for our Economic Supports Division, came and provided you with a presentation on SNAP or food share benefits. So I don't want to go into that too much. There was one thing right about the middle of the page where it's split up between the House bill and the Senate bill, what they what they arrived at, focusing on the Senate bill side. There was a increase in the work requirement age from 55 to 64 for food share benefits or SNAP benefits. And it says it applies to parents of children aged 10 or older. I believe that's now with the final bill signed, that's 14 years and older. So the age requirement, or the age range went up for work requirements, and it applies to parents of children 14 and older. Just below that, and under Medicaid/healthcare, under the Senate column, it says same as House, except the work requirements would go into effect on January 1st of 28, or I'm sorry, December 1st of 28. I think the actual date for that is it's the end of December of 26 is when those work requirements would go into effect for Medicaid. And then just to highlight a couple of things. So the backdating for Medicaid was reduced from 3 months to 2 months when someone's determined to be eligible for those health benefits. That was reduced to 2 months. And the last thing on that page, on page 36, is related to non-citizens. There was a memo that came out from the Health and Human Services Secretary Kennedy earlier this week around Title X reproductive health benefits for non-citizens. The memo was unclear as to what exactly it would mean for us, our public health department, in terms of how we would serve or not serve undocumented folks. So we're, along with the Public Health Association, we're paying attention to that to see what it means in reality. The next page, on page 37, I didn't have, let's see. Oh, there was a thing that Dr. Finley might be aware of too, is there is a provider tax reduction in the One Big Beautiful Bill. The provider tax, my understanding is it's a tax that hospitals pay on revenue that they receive, and then they turn around and that taxed revenue gets a match from the federal government, and that's then repaid to the hospital to help cover uncompensated care or gaps in funding because Medicaid rates are low. The federal government reduced that rate, that provider tax rate, so that hospitals wouldn't be able to recover as much. But the state budget in Wisconsin increased the provider tax to 6%, I believe, right before the federal budget passed. So it didn't apply to Wisconsin. And that's good news for hospitals in that they can recover some of the uncompensated care that they otherwise wouldn't have been able to. And the last thing I highlighted on this page, and I'll try and answer questions if you have questions about anything else, was related to 1115 waivers. Where this applies primarily is to the federal waiver that the state of Wisconsin applied for to allow Medicaid reimbursement for places like Winnebago for a state hospital, where right now, as Faye said, we have to recover whatever we can from third-party payers, health insurance, or private pay. I don't think we get anything from that, but this waiver would allow Medicaid billing for those kinds of stays for people that are eligible for Medicaid. I haven't heard anything definite yet about the status of the state's application to CMS, Centers for Medicare and Medicaid, around this waiver. We knew it would take a couple of years probably to get it approved, if it's approved. But it seems the tone I'm hearing from the state right now is that it's less likely that this waiver will be approved, or if it is, it'll be a lengthier process than normal. So where that would help us, of course, is recovering some of the costs related to people with Medicaid who end up in a hospital setting like Winnebago. So we're still hopeful that'll pass, but we're not counting on it like we were before. And even if it is passed, it'll be a little while yet, probably, I'm guessing, a year and a half, 2 years. Then I just wanted to real quick move on to page 38, is that right, of the packet? It it says WICSA update on 2025-27 state budget. These are some of the things in the state budget that were passed and some things that were excluded. Under youth justice, the big thing there was the legislature, the Wisconsin legislature passed about a $1,200 a day rate increase for juvenile corrections. It would have cost us about $1 million a year to place a child in juvenile corrections. However, the governor vetoed that and reduced the rate to $500 for 26, and I think $758 a day for fiscal year 27. So that was, while we don't place many kids in juvenile correctional facilities, if we did and that child stayed there for a year, it would obviously, it would cost us $1 million for that one child, which for a smaller county, it would be bad enough for us, but for a smaller county, that would really be devastating. So the governor vetoed that, reduced the rate, which was good news. There was no funding increase for youth aides in the state budget. Toward the bottom of the page there was a 2.5% increase for foster care and kinship rates, effective the first of the year in 26. Some triple P funding. And I'll just skip over to page 39 to child care and economic support. What I highlighted there was toward the bottom, second from the bottom bullet point. I only highlight this because it was a little misleading. It looked like there was a 2% increase in income maintenance administration for economic support. It's actually a continuation of a 2% increase from previously, so it's not an additional 2% increase. That becomes more important as we start to look at increased administrative tasks related to work requirements and other Medicaid eligibility requirements that our economic support team will have to do going forward. So, and the federal, I'm sorry, I think the federal support for income maintenance is reduced by 25%, so the state has to pay 25% of that going forward. And then I'll skip to, before I lose you, I'll skip to page 40. Slight increase in Medicaid reimbursement for residential substance use treatment. Very small increase for ADRCs, 2.5 million, but spread out across the state. It comes out to about 11,000. Maybe we'll see 15,000 next year for an ADRC base rate increase. We'll see, but I think we're guaranteed 11,000, right? About a 5% increase. Medicaid expansion, of course, wasn't passed, nor was funding increases for community aids, birth to 3, adult protective services, or public health didn't receive any additional funding. The handouts that you had, and let me keep going. I'm sorry, there's one more category, behavioral health. So the $10 million was approved by Joint Finance Committee for development of crisis stabilization, regional crisis stabilization centers. I've talked about this before. Shar and other counties, myself, legislators who were involved in discussions earlier in May around how we could maybe better spend that $10 million than trying to start up these regional crisis centers, and instead devote it to early intervention services like co-responders and peer support and mental health officers embedded in police departments. And we thought we had some traction with that. We thought that would be a thing we could implement right away and expand in those areas and prevent people from going to hospitals or ending up in crisis. But as it turns out in the budget, they ended up going with leaving this $10 million in this category of startup money for crisis centers, which is a good idea if there's a way to sustain them after you start them. And that's the problem, is I don't know that anyone's going to take the gamble of getting one of these up and going with all of the staffing requirements and the cost involved and then only to not be sure if there's going to be any sustainable funding source behind that after 2 years or whatever the period is. So I was a little disappointed that we didn't get some money to expand the early intervention services that we could do more immediately and at least as a stopgap, help to prevent some of these costly hospitalizations and prevent people from being traumatized by, taken across the state in a squad car. And then I think the last on this document is page 41. There was a small amount of money approved for the development of psychiatric residential treatment facilities, PRTFs. These were a thing that we advocated for in the last session. It would give us an option for placement of children with more acute psychiatric conditions and behavioral conditions outside of the limited options that we have now within state and then looking outside of our state as we do now. These would also be Medicaid reimbursable options, so they're a good thing. Again, the amount of money devoted to the startup is very minimal when you look at the cost of operating one of these. So I'm hoping as the state moves forward with getting Medicaid approval through CMS for these kinds of facilities, I'm hoping that as time goes on, we have a sustainable funding source behind them, and maybe this money would be incentive enough for someone to start one in Wisconsin. And there was some money put into school-based mental health services, which was nice. Things that weren't funded were crisis intervention services, weren't fully funded, crisis intervention services and community support programs, which serve people with serious and persistent mental illness in the community to prevent them from ending up in hospitals. The last thing I think related to the additional handouts that you got from the memo that DHS sent out yesterday was just an overview of the impact that we anticipate for Wisconsin of the changes to Medicaid. There is, I've advocated for a long time for Medicaid expansion that would allow for people at 138% of poverty to be eligible for Medicaid, and it sort of addresses that working poor group who maybe work but don't make enough to afford insurance or their employer doesn't offer it. So I've advocated for that on deaf ears, but we tried, right? But now it looks like with the federal budget passing, the one big beautiful bill, that Medicaid expansion states might be actually in a bit of a dilemma. There's 9 states that currently have Medicaid expansion and have what's called a trigger law. And that trigger law means that if the federal percentage of cost sharing goes down, it's currently at 90%. That is, the feds pay 90 cents on every dollar for Medicaid in these expansion states. But if that percentage, federal percentage goes down, it triggers a law within these 9 states that essentially eliminates their expansion, their ability to provide Medicaid expansion. And that would automatically kick off several million people who currently receive Medicaid. So these states are trying to change their own laws to adjust their threshold so that if the feds lower their percentage of participation, that these states won't lose Medicaid for all of those people that are currently on expansion. I just mention that because it contributes to the overall number of people in the country that could lose Medicaid as a result of the changes in the bill. And then as part of that memo that DHS sent out, they also included estimates of the number of people that would lose Medicaid benefits by state. Again, it mentions the trigger law that I just talked about. But if you go down to Wisconsin, it's on the back, of course, they estimate roughly 250,000 people could lose Medicaid. Again, that's largely due to the barriers that they would face in meeting the eligibility criteria with the work requirements and other more frequent check-ins or eligibility reviews. it's not that people aren't already working, it's that a lot of the folks that would qualify for Medicaid are working, but also trying to meet basic daily needs. They might be struggling to maintain housing, find enough to eat, and just basic things like that. Poverty in and of itself is a chronic stress situation where people struggle to meet all of the needs that they have to meet, and to add additional requirements to maintaining their Medicaid coverage might not seem like a big deal for most of us, but it adds to the complications, and it's likely that many of them will not meet the expectations or not have transportation to get work, or not have availability in their communities for work or volunteerism. So there's a lot of barriers that people in this situation face that most of us maybe don't, that I think contribute to the urgency of their need for health care, but their inability to follow through with some of the requirements. So I will stop there and see if you had any questions for me about any of this. Well, we'll keep monitoring it. When I have something more firm to show you that applies, it would be more specific to St. Croix County or even the state of Wisconsin in terms of what their plans are with going forward and the funding involved with that, then I'll share that. I'm not trying to throw out confusing information. I'm just trying to let you know that we're trying to stay on top of this so that we understand what the impact will be to us and our community partners and the populations that we serve.
I did have one question regarding veteran services. There was some, I thought I read a news report last week about veteran services and some facilities that were going to be closing or something. Did I make that up in my brain, or? I think it was Chippewa Falls, right? And Green Bay.
And I'm not going to be able to, I read about veteran services and the impact from Medicaid changes, and I don't have that in front of me, and I would be afraid to try and remember what those changes were. But there were some veterans that were affected, some veteran groups or veterans that were affected by the Medicaid changes. I just don't remember the details.
Okay.
I'm just wondering if, is this, what the impact is going to be to hospitals because people, if they lose their Medicaid, they're going to present to ERs, and if we're working with them or doing, is there any discussion in that area?
Yeah, and that will be an impact where more people will wait until they're very sick and then end up in a hospital or a crisis situation of some kind. So that will impact, I think, hospitals. Dr. Finley could probably speak more to that, but it's just a fact that the fewer people that have insurance will get help in an office versus an emergency department, depending on their insurance status. It's really not that different than our employee on-site clinic. If people go to doctor visits at our on-site clinic, they're less likely to go to an emergency department. And it's the same thing for anybody with health insurance. If they don't have health insurance, they're not going to go to a doctor visit or to an office visit with a doctor to get preventive care for chronic conditions or whatever their situation is. They're going to wait until they absolutely can't wait, and then they'll go to an emergency department. And that uncompensated care will be fewer people on Medicaid will be a factor for hospitals. That provider tax that the state passed that I mentioned that they raised to 6% will help hospitals. I think that was a sigh of relief. But Dr. Finley, I don't know if you have any additional comments.
Yeah, this has been a very, very scary situation for us. And just as Bob was saying, we're trying to keep our finger on the pulse of what does this really mean. It's hard to make sense of it. But I can share with you that we've already seen patients being hesitant to receive care because they're not sure about their coverage in the future. And that is really disturbing to us from a standpoint of just providing that downstream or that upstream care to prevent downstream costs. Additionally, as our rural facilities are really impacted with a disproportionate number of Medicaid recipients, and struggling with keeping the doors open anyway, there's a lot of fear across the nation about what this will do to our rural or critical access hospitals. There are some federal regulations that help support that, and indeed, the budget that was passed in Wisconsin was incredibly, it was incredibly reassuring that that was unprecedented in our state, but again, there still continues to be a lot of concern. And for me, just to see the impact on patients and their ability and their willingness to receive that care is concerning. And then additionally, just the added stress on the patients as well as on the care teams in not being able to provide care that they know patients need. So still very concerning, but again, trying to make sense of what that means. But knowing that we have organizations, I think we all in this area just want to continue to care for patients, continue to care for our community, and that will drive us forward. So.
Thank you. Thanks, Bob. Next item, overview and update on services and programs for the unhoused housing and housing insecure in the St. Croix County.
Thank you, Mr. Chair. We had hoped to have Scotty Ard here from the Salvation Army to do a presentation tonight, and she just got too busy at the last minute and asked if she could do it another time. But she did provide me with this overview of some of the things that they offer through the Salvation Army, support and programs for housing insecure or homeless folks, and some of the what was I going to say? Some of the just some of the like learning focused programs that they have for folks. So that she did mention, as you can see in the opening paragraph of what she provided, that about 10% of the people, they typically serve people who are unhoused for about 30 days in the shelter setting, but about 10% of those folks, because they're difficult to find, it's difficult to find permanent or even temporary housing for them because they're older, because they maybe have a disability or behavioral health condition, but it becomes very difficult to find placement. And so about 10% of the folks they serve end up remaining there for up to 6 months, is what she's saying. So I know that I talked with Scotty quite a lot over the years I have, and her concern too is around the number of folks with behavioral health conditions and the aging population of the shelter. Just that some of the residents are getting older, more frail, have medical needs and other needs that historically haven't existed to that extent anyway. And it's really straining, of course, the safety net in that way, and that where do you go if you're if you're having trouble placing someone because of those conditions, because of the restrictions or housing costs or whatever the case may be. I think they do a nice job at the Salvation Army with case management, with these programs that she's listed here, in trying not only to find housing for people and get them the help they need for behavioral health conditions, but also in helping with things like budgeting, resume writing, and interviewing, and what are your responsibilities as a tenant? What are your rights as a tenant? Those kinds of things are really important, I think. Helps people to understand better how to approach, again, obstacles that maybe many of us don't often consider in our lives. But the one thing I wanted to mention also, and what Scotty provided, was Grace Place, as she said, is the only permanent supportive housing program I don't know what page on your packet this is. It's probably the last one. It's the only program in Wisconsin that exclusively serves people with behavioral health conditions, addiction and mental health conditions, which is, I know she's proud of that, and they do a good job with us, HHS, with working with that population and trying to come up with ways in which to safely house them. Recovery housing, I know you work, Onyx works with them as well. But that population is growing, or it seems to be, in terms of percentage of the people that are homeless and need a safe place to be, to give them a foundation for recovery. And as she says, there's no easy answers, policies, or laws to end homelessness. I worry that if the number of people that lose health insurance goes up dramatically, that we'll see an increase on that part of the safety net as well. But we have the right person there at the Salvation Army to help us with that. So I apologize for not doing a better job of explaining this. You had to listen to your tired old HHS director instead of Scotty Yard, but I hope her written summary kind of helps you at least understand some of the things that they offer there.
I thought you were going to do it as an impersonation of Scott.
I don't, that would be a challenge.
I had a question about if she mentioned when you talked to her about funding and grants and stuff, if that has been affected by some of the changes.
I know there's been some cuts to HUD funding, how that impacts her. I know she's watching it very closely, so again, she would be the one to explain how any of that is affecting grants that she may have or was hoping to get. That brings up one other thing. I'll just mention it. I'm not going to go into detail, but the Senate right now is in session looking at a rescission bill that would claw back about, I think it's $900 billion possibly, in money that was already approved by Congress for various things. I think 90 million maybe so far. Maybe it's more than that. I don't remember. Some money has been taken back. This is money that's already been approved by Congress, and the Senate is looking at clawing it back. Some of that money had to do with substance use treatment. I think it was prevention related, but I know there's concern nationally anyway about the impact that could have on the opioid situation, in that we were making progress, are making progress on that front, and some of this money that was clawed back, according to according to news sources that I read anyway, it seemed like that would have a negative impact on the opioid crisis if they, well, it looks like they've already done that. But we'll have to wait and see how that rescission session goes with the Senate that's going on right now, I think.
So if we've already spent it, hypothetically, so if a clawback happens, if it's allocated and we already spent it, then
I think it just, I don't think they would take back anything.
you
that's
can't
already
take back
been spent.
nothing, right? So spend
I think
fast.
it
I mean,
it would be money that's been promised but not spent.
okay.
Yeah. So there's some good news.
Any other questions? Thanks, Bob. That's it for business tonight. Requests for any future agenda items? Just keep us informed. Any announcements?
Well, the fair starts tomorrow. Make sure you get out to the fair.
Should find out Monday if we get some matching dollars from Vital Strategies, matching dollars for opioid settlement funds that we've already received. It could be up to $100,000. I'm hoping it is, but we'll see on Monday. I'll let you know.
No other announcements? Our next meeting will be August 20th, and I guess we are adjourned. Thank you, everyone.